Hello and welcome. I'm really happy you can join me today. My name is Jeremy Peterson, and I'm proud to share my Capstone project on a community based health intervention focused on increasing access to healthy foods in order to support Indigenous food sovereignty for children in remote First Nation communities across Canada. This project demonstrates dedication to address systemic food insecurity and promote cultural rejuvenation and resilience. So, let's think more about the barriers faced exclusively by Indigenous children and youth living in remote communities in order to better understand the challenge we are addressing. In these remote Indigenous communities, food insecurity can be a complex issue tied to historical, social, and geographic roots. And it's most especially Indigenous children and youth among those aged 1 to 18 years old. Food insecurity has profound effects on their physical development, education, and mental well being. So, we are not only talking about the simple matter of what to eat, but food insecurity here impacts so many facets of a child's development. By acknowledging this vulnerability, this project consciously targets this age group to foster ongoing health and cultural identity and lay the groundwork for a lifetime of well being. So, as we have identified in the previous sections and set the stage for the problem, we need to look at what the literature tells us about the larger systemic barriers and how solutions might actually work. As research indicates, food insecurity of Indigenous peoples is beyond the reach of income support alone. Systemic obstacles, including lack of food infrastructure, disrupted access to Indigenous foods due to colonial land dispossession, and cultural disconnection, are all factors. Food sovereignty emerges as a solution for which is pivotal. It acknowledges Indigenous peoples' rights to manage their food system, preserve cultural practices, and return to ecological responsibility. Research has also shown that food insecurity in young people is associated with poor health outcomes, such as obesity and mental health difficulties, as well as low academic achievement. By fostering community led, culturally grounded interventions and connecting Indigenous know how and modern nutritional science together, we can show a clear and consistent benefit in health and social well being. So these findings have guided me to formulate a framework grounded in collaborative and culturally respectful approaches to help inform the intervention in Indigenous communities. My project adopts a community-based participatory research basis. In my project, working with Indigenous peoples as equal participants in all stages of methodology, from design to evaluation, helps in promoting the safety and relevance of Indigenous peoples, from the start to end and through their role as the culturally relevant partners in the project. Central to this is the focus of OCAP principles that uphold Indigenous data sovereignty and honoring Indigenous data sovereignty over which communities retain control around and access to their data. Importantly, the initiative consists of three primary stages. The first stage includes community engagement and baseline assessment. The second phase involves infrastructure upgrades, nutrition education, cultural programming, and subsidy programs. And the third stage includes evaluation with sustainable action plans. Furthermore, this effort is backed up by a $500,000 budget which covers teachers and elders, as well as materials for community freezers and culturally relevant education tools. So, with this framework established, the challenge was to collect comprehensive data through a mixed methods design honoring Indigenous knowledge. The data collection included both quantitative and qualitative methodologies to account for the many levels of food insecurity and cultural experience. Quantitatively, culturally adapted food security surveys and diet frequency surveys measured economic and physical access to food and dietary patterns. So, through a quantitative assessment, talking circles, focus groups, and interviews facilitated participants' sharing of cultural relevance and empowerment through traditional storytelling. In addition, the analysis used thematic content and narrative storytelling based on Indigenous knowledge systems with a careful approach of triangulation and member checking to confirm conclusions. So, taken together, this method gave a full and sensitive picture of how much was the impact. So, let's move to what we learned from this data. What key outcomes show what impact the intervention had? After 18 months of intervention, household food security was improved by 10%. Critical to this success were infrastructure improvements like community freezers that make fresh and traditional foods significantly more available, longer lasting, and shareable by reducing spoilage and the supply interruptions that often accompany the remote food markets. This also increased youth education and cultural development on healthy diet and traditional foodways, resulting in an increase in school attendance and enthusiasm, indicative of wider societal events. Also, the youth reported stronger linkage to the elders and more confidence in harvesting and cooking traditional foods. This made it a culturally resilient and rebuild cultural pride. However, it is important to note that some issues persisted, such as the case in seasonal logistics, shortage of funds, and also balancing participation in the family's livelihood demands. So despite some encouraging signs that progress has been made, it is important to realize the needs for the real-world context in order to realize sustainability. In order for such interventions to be sustainable, Indigenous leadership and governance is necessary. Programs must be community-owned and culturally tailored. Combating food insecurity involves cooperation among health, education, infrastructure, and policy sectors. Nutrition education should incorporate Indigenous knowledge and science using teaching methods such as storytelling and land-based learning. Furthermore, policies should support subsidies and infrastructure investment, such as cold storage to support traditional and market foods. Additionally, local capacity building and respecting data sovereignty are also vital in long-term success and are needed to uphold community-owned responsibility and ethics from the outset of research and evaluation. So despite these successes, we met with challenges in the project and pointed out areas that we can continue to improve on in the future. With these challenges came forward limitations that involved limited geographical spread of the project, as well as limited duration to assess the long-term effects of the intervention. There is often weather and logistical disruption of food delivery and program activities, but however, there are the usual biases that come from relying on self-reported data. Competing livelihood priorities and program fatigue led to differences in community engagement, and the scalability and sustainability risks are created by funding volatility. Moreover, although food security was widely discussed as an overarching issue, integrated and synergistic access between social determinants, including housing and mental health, is still needed. Going forward, Indigenous research should be broader in scope, longitudinal in nature, track multidimensional outcomes, adapt in a manner that doesn't leave remote areas behind by digital, and create outcome measures led by Indigenous people. The effect of climate change on Indigenous foodways is also needs a place. I believe the role of Indigenous community research leadership will continue to be critical moving forward, and these lessons can help to solidify the larger mandate to promote Indigenous food sovereignty as a pathway to long-term health, equity, and cultural revitalization. In closing, the problem of food insecurity for Indigenous children living in remote First Nation communities is a result of a variety of historical, cultural, and systemic issues that must have comprehensive solutions. This work demonstrates that culturally based, community-focused interventions can produce quantifiable improvements to food security, nutrition, and cultural connection, and empowering young people and building stronger community ties. We cannot abandon Indigenous food sovereignty for nutrition and health, and for cultural revitalization and self-determination. These initiatives are consistent with larger national reconciliation aims and present a scalable model of Indigenous-centered health innovation, in which I believe this approach offers an important model for advancing reconciliation and public health in Canada. And lastly, I'm optimistic that the model I presented here can inspire similar initiatives across Indigenous communities in Canada and around the world. Thank you very much for your time and attention. I truly appreciate the opportunity to share my work.